the governor, all the guests invited, ladies and gentlemen, good morning. Good morning once more. My name is Dr. Wanambisi Kale. I'm the director in charge of Health and Sanitation, Bungoma County. Allow me to take this opportunity to welcome you to this event. It is a very important event to us, so feel free. I know that you are at home here. We want to celebrate together the World HIV/AIDS Day today that is normally commemorated globally on every 1st of December every year. We are expecting our chief guest to come in, but before she comes, I would like to take you through the HIV profile in Bungoma County. Basically, what we are having at the moment, we have around 30,000 people living with HIV, and they have been put on treatment. The main purpose we are here today, ladies and gentlemen, is we want to fight or to end what we call the triple threat. The triple threat in this case includes we want to fight against teenage pregnancy. That is one. Number two, we want to fight against new infections that we have seen. There is an increase in number of new infections among our population. And also, we want to fight against sexual gender-based balance. Based on our statistics, we know compared to the last year, our figures have gone up. So we need to join hands, all the stakeholders on board, so that we can fight this cause together. Our basic concept here is we want to address what we call primary health, because at the moment we are offering various services in our health facilities. Especially, we have established so many care centers that we are handling people who are living with HIV. And also, we have enrolled several clients on medication, and they are being followed up in our various facilities. The other issue is about gender violence. We have established what we call youth-friendly services in our facilities, and at the same time we insist or we emphasize on our staff, especially in the medical field, so that we join hands with other stakeholders to make sure that we fight the madness of sexual gender-based violence. It happens in Bungoma County, we have around 9 sub-counties, and this issue of gender-based violence is rampant in Mount Elgon region and Cheptais. And this is why we are here. We want to make sure that we bring everyone on board so that we make sure that we reduce or we stop this sexual gender-based violence. Another thing is, in our facilities, most of our facilities, we've made sure that we establish the youth-friendly services so that we can be able to capture our young ladies and gentlemen, so that whenever they are seeking services, they can come comfortably and be able to be given the service that is available at our youth-friendly whatever areas. The other issue is about teenage pregnancy. You see, it's so easy for someone to get pregnant, but imagine having a pregnancy at an early age. Like, for instance, in our facilities, sometimes we get cases of teenage pregnancy as early as 10 years or 11 years. We are like, in our records, we have cases whereby you get a teenager at around 10 years is pregnant. And imagine carrying that pregnancy to terms, it has a lot, complications and everything else. So what I will urge all of us, we need to join hands together as we fight this cause together, because we can't do it alone. As the Department of Health, Bungoma County, we are willing to go extra miles so that we make sure that we fight this cause together. And in any case, I want to recognize our partners, especially local partners, who have really assisted in the fight against HIV/AIDS and the sexual gender violence. There's a lot that we've done. There are several measures we're putting in place. We have made sure that every mother who comes to the facility is tested for HIV and AIDS. We urge all other members of the public, please make sure that you test. We have availability of testing kits, but sometimes they run out of stock, but we make sure that we replenish. So basically, I will urge all of us, especially those fellas who have not, people who have not tested, to make sure that they come for those tests so that you get to know your status at that time. The other issue is we've made sure that those people who are found to be HIV positive, they are put on treatment and care. You know, basically, what kills someone who has contracted HIV is the opportunistic infections. But once you are put on those medications, there is availability of antiretrovirals in our facility. We make sure that we replenish our stocks so that we can be able to handle these cases. And most of our clients, they are on care and they are adherent to medication. The other issue is we make sure that especially those mothers who get pregnant and maybe they're HIV positive, they are started on medication so that we control. We don't want that transmission to the mother to child. We have a program running that, and it is going on well. The other issue that I would want to mention is in our facilities, sometimes we run out of stock in terms of the preventive measures like the condoms, but we are working together with the NASCOP, that's the national government, and our partners in place to make sure that we have condoms available. We've been interacting with the youth, and they've been complaining so much about availability of condoms. We are working that tirelessly to make sure that we have condoms in place so that we can prevent this scourge together. Ladies and gentlemen, as I told you, we can't fight this alone. So on behalf of our department, I will urge and I will request and pray that everyone to come on board. Everyone, those people who are living with HIV, there's a lot we learn from them. And also the leaders, especially the political leaders, they need to assist us so that we can drive this message home. We've organized through the public health to make sure that we go through barasas so that we can preach this gospel as we try to fight these triple threats. You know, at the moment we are having a lot of challenges, but I can assure you, with all of us on board, we can make sure that we can surmount these challenges. Ladies and gentlemen, with those few remarks, I would kindly request that you feel free around. We are going to move this together. We are going to work together. We are going to consult, and we make sure that we fight the triple threat together. Thank you so much.
Ladies and gentlemen, a round of applause to Dr. Caleb Wata, please. Pigeni makofi, Dr. Wata Wanambizi, who is also the director in the Department of Health Services and Sanitation. Our next facilitator to speak about Equalize and ending new HIV infection, adolescent pregnancies, and sexual and gender-based violence, the triple threat, is John Dakuya, who is also the program officer, USAID Dumisha Afya. Ladies and gentlemen, please put your hands together for Mr. John Dakuya from USAID. Welcome, sir. As he makes his presentation, we have got a Huduma Center here giving us all the services for free. Sasa tafadhali fika pale uweze kupata huduma zozote za huduma za Kenya. Pili, tuna blood donation hapa nyuma. Also feel free to donate blood. John.
Okay. All protocols are observed. Ladies and gentlemen, good morning. Good morning once more. My name is Ndakuya John from USA Dumisha Afya. I'm going to talk about the triple threat and the theme for Wales Day this year. As you are all aware, and you've been able to see all the communication materials that have been displayed around, we are communicating towards ending the triple threats that we are facing in Kenya. And the triple threats that we are facing, we want to address. One is the new infections that are emerging day in, day out. Number two, the other thing that we are having is early and teenage pregnancies that is very rampant, and more so, as the previous speakers have said, Bungoma is also part of that. Then number three, we're also having sexual and gender-based violence that is really eating us, and is really a headache amongst our populations. So number one, we've really understood that HIV infection is on the rise, and we are having HIV infection that is early, and we need to make sure that as people of Kenya and people of Bungoma, we are aware of this, because strategies have been put in place just to make sure that the infections are reduced. But you can see the data, infections are still going up. But what is happening? We are having challenges in disclosure of those who are HIV positives, in that they cannot be able to inform other people that they're HIV positive. So they engage in sex without protection, and that is specific, without using a condom. And in that line, they'll be able to infect other people with HIV, and giving a rise to HIV infections around the country. So we have a task to do as Kenyans, as healthcare providers, and everyone in Kenya, just to make sure that we reduce the new HIV infections. But we cannot reduce HIV infections if you don't have information. And I'm happy this session, we are giving information to the public that you need to understand how HIV is transmitted, and you need to understand how HIV can be prevented. And as we are having slogans that we need to condomize, because HIV infection, the highest rate of infection is through sex. So number one, I know a large number of persons who are here, we've ever engaged into sex. And at some point, we've engaged into sex, number one, using a condom for the first time. Then for the second time, you've engaged using a condom. Then the third time, if that partner, you've come to a realization that now you are intimate, at some point you may not be able to use a condom. So at that point is whereby when we are going to get new HIV infections. So what do we need to do? We need to have people having only one partners and being faithful to them, and making sure that if you're not able to abstain, if you're a youth, be able to use a condom. For that, you're able to prevent HIV to the public. And I'm very happy, again, the Ministry of Education has included the HIV in the curriculum, and making sure that each and every person is able to understand that HIV is real and HIV is here with us. So that's the first thing that we need to make sure that we're able to prevent HIV to the populations. Number two, triple threat is early teenage pregnancies. I know across the country, everywhere, we are hearing teenage pregnancies, and we are getting even 12-year-old children who are getting pregnant, and at some point, if they get pregnant, that means they were able to have sex without a condom. But that is not right, because that's not the right age for them to have a pregnancy, or that's not the right age for them to be able to sire a child. So what is happening? The older men in the country and the older men around are going to these young children, by hoodwinking them, in the essence that they give them some incentives, like at some point they have some monies that they offer to them. And you know, at this point, these children, they may not be able to control themselves, or they may not be able to make decisions that according to what they have been alluded to by the guys who are giving them incentives. So this is what's happened. That a child in high school who is a day scholar, going home on every day, and is not having transport to go home. So find someone with a vehicle and gives her a lift. And in that lift, that girl is given around 20,000, which will lure that lady to fall into love or have just sex with that person. You know, that's something that is very bad. And I know the issue of sponsors is really going around the country, and these are the people who are really doing bad to our children. So today, what do? We need to end this menace of having sex with young children and in the long run giving them or making them pregnant. So if they get pregnant, if they have not used a condom, then we are having infections, HIV infections among these populations. There are notions that people are having about a cure or myths on HIV, that people just want to go for young children just to make sure that they're able to get a cure. Please, that is a myth, and we should be able to desist from that. Kindly, I urge the team that we need to end early teenage pregnancy among our children. Number 3, sexual gender-based violence. And this is very common for the people who are HIV positive and the people who are HIV affected. One, this person is HIV positive. This is a chronic illness. And it is a chronic illness that someone will be able to take medication in his or her lifetime. At some point, the person may not be able to be accepted in the community just because he was able to get HIV, which is a sexually transmitted infection. And everyone knows that this person was very promiscuous, and that's why they may be able to want to discriminate this person. So these people have been left behind. At some point, they are not even given time to go to school. Services at their homes, family members are not taking care of them. And that's why you'll find that these people are people who are living with HIV. We are having deaths across. And the thing is that once they are discriminated and they are stigmatized, they may not be able to take the medications as prescribed. And in that manner, they'll be able not to have viral suppression as required by the healthcare system. So the other thing is that at some point we are having clashes or misunderstandings among the communities that's really leading to gender-based violence. And again, I want to allude that gender-based violence is not only for the female, but gender-based violence, again, is also for the men. And men, again, at this position, men don't turn up to show up if they have been violated because of fear. But today, as a strategy of equalize and triple threat, we are calling upon everyone, if you are violated, despite your gender, despite your age, please come out and report that. Because there are structures in place that can be able to help us ensure we end sexual and gender-based violence amongst our communities. The other thing is that we're also having gender-based violence in our workplaces, in our homes, that just go unreported. Today, gender-based violence is really contributing to HIV infection, because if someone is raped, you don't know the perpetrator had HIV or not. So what happened is this, that the survivor will be left with HIV unknowingly. So if we don't follow up this, then we're able to transmit HIV to the community and to the people in Kenya as a whole. So what are we calling us to look at? Today, this year, we want to equalize. In Kiswahili is